Hi, I'm Noreen Wofford from UC Berkeley, and my final project is responsive in vivo antibody production for Clostridium difficile infections. C. difficile is one of the most deadly infections in the U.S. That's because in the last 10 years, an antibiotic-resistant strain has emerged that causes 453,000 infections per year and 29,300 associated deaths. The mechanism of action for this infection is that when a patient, especially the elderly, goes to the hospital and takes oral antibiotics, the intestinal flora is disruptive and the antibiotic resistant infection grows up. It secretes a toxin that damages intestinal cells, and the infection is only eliminated after the patient stops taking antibiotics and the native intestinal flora can return to outcompete it. The secreted toxin binds to receptors on intestinal cells, is endocytosed and escapes the endosome, and then disrupts the function of receptor-coupled G proteins within the cell. Antibodies have been shown to be effective in reducing toxicity from this infection. The mechanism of action is that an antibody binds to the active site on the toxin. This means that it cannot bind the receptor on the intestinal cell and be endocytosed, meaning that the infection is completely harmless to patients. My proposed system is an engineered E. coli population that, in the presence of free toxin in the intestine, will produce and secrete antibody fragments that bind to the active site of C. diff toxins. The second element is that, in the presence of an arabinose pill that a doctor prescribes, the cells will completely apoptose in an antibiotic-free system. This is important because the lack of antibiotics means that there's not another chance for C. diff to grow up again. In the parts for my proposed system, the C. diff toxin, TCDA, binds to respondent promoter, which causes the transcription and translation of T7 polymerase. This buffer element was chosen because T7 polymerase can transcribe genes very efficiently under the control of the T7 promoter with only a small amount of T7 present. The genes under the control of the promoter is an anti-TCDA antibody fragment and also the protein site-FKPA. This is a mutated FKPA chaperone and proline isomerase lacking a signal sequence that would divert it from the cytoplasm. This has been shown to improve correct folding and secretion in E. coli antibody production. Through this system, antibody fragments are strongly expressed in the presence of C. diff toxin. When arabinose is released in the intestine, it binds constitutively expressed ARSC. ARSC is a protein that binds the PBAD promoter and prevents it from expressing genes under its control. When arabinose is introduced, it binds ARSC, causing PBAD to become free and transcribe and translate the genes under its production, which in this case is apoptosis-inducing factor. In my abstraction of the system, first, free TCDA is taken up at the rate K uptake and degraded within the cell at rate K deg. Within the cell, it binds to the TCDA promoter at forward rate KT on and reverse rate KT off. This toxin promoter complex can transcribe and then translate the T7 polymerase, which is also degraded at rate K deg. T7 polymerase will transcribe genes under the control of the T7 promoter at forward rate KT on, reverse rate KT off, and transcriptional rate KTX times the strength of the T7 promoter. It transcribes two mRNAs, which are translated into site FKPA and the antibody, which are both degraded at rate K deg. Site FKPA and the antibody come together within the cell to cause the antibody to be secreted to the intestine. Inside the intestine, the free antibody couples to the TCDA toxin, causing the complex to be harmless to the patient. The second element of my system is that releasing arabinose in the intestine triggers the death of the engineered population. How this works is that the ARSC protein is constitutively expressed under the control of a lac promoter. It's degraded at rate K deg, and it binds to the PBAD promoter and causes it to be inactive. When arabinose is added to the cell, it binds to ARSC at rate K era on and reverse rate K era off. The PBAD is the genes under PBAD coding for the apoptosis-inducing factor is then transcribed and translated. I use the following reactions to model my system, using simple rate laws to create a series of differential equations, and in the case of binding to promoter sites, I used Michaelis-Menten kinetics. To simplify the model, I assumed that ribosomes, DNTPs, polymerases, amino acids, and the transport proteins are abundant, and that each part has no binding reactions outside of the system. Within the system, I have assumed that TCDA is taken up by E. coli, that genes within an operon are transcribed at identical rates, and that antibody fragments are completely secreted and bind irreversibly to TCDA. I wrote each reaction in my abstracted system using rate constants, then found compositors and rates that describe the net rate of change of each molecule in the system. I used the MIT part compositor framework in MATLAB to model and graph my equations. So my modeling showed that the engineered cells were successful in both responding to TCDA with antibody production and responding to arabinose with apoptosis. When TCDA-free was added to the system, the amount of antibody expressed and secreted quickly went up until all of the free toxin was completely bound to antibodies. I was also successful in having arabinose trigger apoptosis. You can see here that when arabinose is added to the system, the proportion of bound PBAD promoter drops and the proportion of free PBAD increases quickly, so that apoptosis-inducing factor is steadily secreted from that point onwards. Finally, I use monod modeling to model the growth of the E. coli cells. Monod modeling is a saturable equation that assumes growth-limiting substrate is present and that growth occurs at high rates at low cell density and low rates at high cell density. Therefore, the curve has a sigmoidal shape which reaches an asymptotic limit at about 1.2 cell density. In this graph, at 15 hours, arabinose was added to the system, and in 1 hour after that, cell death became noticeable, and within 5 hours, the engineered cell population was completely eliminated. In my project, I have had successes modeling responsive antibody production and apoptosis. By choosing the non-leaky PBAD promoter, I was able to avoid significant apoptosis without arabinose in the system. I found that E. coli's native uptake and secretion pathways were sufficient for the uptake of toxin and the secretion of antibodies. Antibody therapies have been shown to have a 4-fold improvement in preventing relapses, mainly because the standard of care is antibiotic treatments that actually create the environment for C. diff infections to grow up again. My system probably has an even greater improvement because it eliminates the need for patient compliance in taking a daily pill and because it responds precisely to the amount of toxin in the system. However, there are several limitations, namely that my population is under a heavy metabolic load because of the large antibody it produces. This could cause mutations that would make it less efficient or also make it susceptible to outcompetition by native gut bacteria before the C. diff infection is eliminated. Finally, although the inducible cell death component has a minimal metabolic burden, thus a low driving force for mutation, a mutated bacterium could become resistant to the arabinose-triggered apoptosis, and therefore, toxicity studies have to be shown that permanence in the gut is fine. In my next iteration of the system, I would include either a TCDA-induced urinary marker that can be used to monitor the course of infection, or trigger E. coli apoptosis through a memory switch that activates when TCDA has been bound before, but is not present anymore. These measures would be because it's difficult to tell when the C. diff infection has been completely eliminated, and so patient care would improve if doctors didn't have to guess when the infection has been eliminated and the engineered cell should be removed from the system.